Common types of chemical exposure in the workplace. Chemical exposure in the workplace isn't rare, and it isn't harmless. Every day, workers are exposed to hazardous chemicals by breathing them in, absorbing them through the skin, or coming into direct contact on the job. Over time, those exposures can cause serious, life-altering injuries, things like occupational cancers, neurological damage, respiratory disease, and even reproductive harm. In many cases, these injuries happen because basic safety measures were missing. No proper warnings, no protective equipment, no real safeguards in place. These aren't accidents, they're preventable failures. At Gianaris Trial Lawyers, we represent workers across the country who were harmed by toxic chemical exposure at work. These cases are complex, and they're built for trial with one goal: holding employers, manufacturers, and other responsible parties accountable for the damage they caused. In this video, we're going to break down some of the most common types of chemical exposure in the workplace, where they happen, the injuries they're linked to, and the industries most at risk. Check out our video, The Process of a Workplace Chemical Exposure Lawsuit, where we also cover the legal options available to injured workers, how chemical exposure lawsuits work, and what to know if you're considering taking legal action. How does toxic chemical exposure occur? Toxic chemical exposure can happen in more ways than most people expect. It often occurs when workers breathe in harmful vapors, dust, or airborne particles, or when chemicals enter the body through direct skin contact. Many workplaces use chemicals every day, things like solvents, cleaners, fuels, adhesives, and pesticides, so the risks are often underestimated until symptoms appear. Some exposures happen suddenly, like a spill or leak that causes immediate injury. Others happen slowly, in small doses over time, and can be just as dangerous, sometimes more so. The risk increases when ventilation is poor, chemicals become airborne, containers are mislabeled, or workers aren't properly trained or equipped. Even routine tasks can become hazardous when chemicals are heated, sprayed, or mixed. And in many workplaces, chemical exposure is combined with heat, confined spaces, or high-pressure systems, conditions that amplify the danger and make injuries more severe. Who is at risk of chemical exposure in the workplace? Chemical exposure isn't limited to one job or one industry. It affects workers across a wide range of roles, especially in environments where chemicals are used, stored, processed, or generated as part of everyday operations. Workers at higher risk often include railroad workers, factory and manufacturing employees, mill and plant workers, refinery and chemical production workers, and employees in industrial or production facilities. Many blue-collar jobs involve regular contact with solvents, fuels, coatings, cleaners, lubricants, or industrial byproducts that can become hazardous without proper controls. Risk also extends beyond traditionally industrial jobs. Maintenance workers, mechanics, cleaners, painters, agricultural workers, and others who handle chemicals as part of routine tasks may face exposure, sometimes without realizing it. Ultimately, any job that uses chemicals, creates fumes or dust, or involves heating, spraying, mixing, or cutting materials can carry exposure risk. And when safety training, ventilation, or protective equipment falls short, that risk increases significantly. What to do if you suspect toxic chemical exposure? If you think you've been exposed to a toxic chemical at work, take it seriously and act quickly, even if the exposure seemed minor at the time. Report the incident to a supervisor and ask for a written report. Details matter. What chemical was involved, where it happened, and how long you were exposed can all become critical later. You should also ask for the Safety Data Sheet, or SDS, for the chemical involved. These documents explain the risks, first aid steps, and proper handling procedures. Seek medical care as soon as you can and tell the provider exactly what you were exposed to. Occupational health providers can help document symptoms and connect them to workplace conditions. If there's concern about a spill or airborne exposure, request that the area be evaluated for safety and compliance with exposure limits. Finally, keep copies of everything,
medical records, job assignments, incident reports, and any safety complaints. Chemical injuries are often delayed and documentation matters. And if your employer downplays the issue or you're worried about retaliation, speaking with a lawyer early can help protect your rights while the evidence is still available.
Types of chemical exposure in the workplace. Chemical exposure in the workplace typically falls into a few common categories. Categories include 1. Inhalation exposure. 2. Dermal exposure. 3. Ingestion exposure. 4. Eye exposure. Some exposures involve toxic substances like benzene, formaldehyde, silica, isocyanates, or heavy metals, while others involve corrosives that burn tissue on contact. The scope is enormous. There are tens of thousands of workplace chemicals in commerce, and not all hazards are obvious from smell or immediate irritation. We will break these 4 exposure types down one by one. Type 1. Inhalation exposure. Inhalation exposure happens when workers breathe in chemical fumes, vapors, gases, or dust during routine tasks like spraying, mixing, sanding, welding, or degreasing, especially in poorly ventilated areas. Even when chemicals aren't visible in the air, vapors can build up in enclosed spaces. Over time, repeated inhalation can damage the lungs, worsen asthma, and contribute to chronic respiratory disease or occupational cancers. Type 2. Dermal exposure. Dermal exposure happens when chemicals come into contact with the skin and are absorbed or cause direct damage, like burns, rashes, or blistering. This often occurs from splashes, leaks, contaminated gloves, or handling wet materials without proper protection. Chemicals can also soak into clothing, tools, or reused protective equipment. Because skin exposure is often gradual and less obvious, it's frequently overlooked until irritation or more serious symptoms appear. Type 3. Ingestion exposure. Ingestion exposure occurs when chemicals enter the body through the mouth, usually from contaminated hands, food, drinks, or work surfaces. This can happen when workers eat or drink without washing thoroughly, store food near chemicals, or unknowingly transfer residue from gloves, tools, or clothing. Even small, repeated ingestions can be dangerous over time, especially with toxic substances that build up in the body. Type 4. Eye exposure. Eye exposure can happen instantly, often during mixing, pouring, spraying, or equipment cleaning. Splashes, airborne vapors, dust, and fine aerosols can all irritate or damage the eyes, sometimes severely, especially in poorly ventilated areas or when eye protection is missing. When eye exposure occurs, immediate flushing and medical care are critical, and these incidents often point to preventable safety failures. How does chemical exposure occur in the workplace? Chemical exposure at work usually happens when safety controls fail or were never put in place at all. Risk increases when employers skip training, ignore safety procedures, fail to provide updated safety data sheets, or introduce stronger chemicals without proper notice, labeling, or protective equipment. Exposure is often made worse by physical conditions like heat, which increases vapor release, or confined spaces which allow toxic chemicals to build up quickly. Employers are required to follow hazard communication rules and monitor exposure limits. But when those responsibilities are ignored, chemical injuries become predictable and preventable. In many cases, exposure comes down to specific tasks. Mixing, spraying, welding, cleaning, cutting, and grinding can all release fumes, vapors, or dust, especially in poorly ventilated areas. Confined space work is particularly dangerous because workers may not realize exposure is building until symptoms appear. These task-based risks often reveal exactly how exposure occurred and whether proper safety measures were missing. Acute exposure versus chronic exposure. Not all chemical exposure looks the same. Some injuries happen suddenly, while others develop quietly over time. Understanding the difference between acute and chronic exposure helps explain why symptoms and legal cases can look very different. Acute exposure. Acute exposure usually happens during a single incident, like a spill, leak, or sudden release of fumes or dust.
Symptoms can appear immediately and may include burning eyes, coughing, shortness of breath, dizziness, nausea, or chemical burns to the skin or airways. In some cases, serious complications develop later, especially when the chemical affects the lungs or nervous system. Because acute exposure is tied to a specific event, these cases often focus on what went wrong in that moment and how the employer responded.
Chronic exposure.
Chronic exposure develops over time through repeated contact with chemicals during routine work. Each exposure may seem minor, but the cumulative effect can be serious, especially when ventilation is poor or protective equipment is inadequate. Chronic exposure has been linked to long-term conditions like asthma, nerve damage, organ injury, reproductive harm, and certain cancers.
Symptoms are often subtle at first and worsen gradually, which is why work history and long-term documentation matter so much in these cases. Health effects of chemical exposure in the workplace.
The health effects of workplace chemical exposure can range from immediate injury to long-term disease. The outcome depends on the substance involved, the dose, the route of exposure, and how long the exposure lasts.
Short-term exposure can trigger symptoms that show up quickly, for example, headaches, dizziness, or nausea, coughing, shortness of breath, or throat irritation, eye irritation or blurred vision, skin irritation or chemical burns, confusion, fatigue, or faintness after a high-level exposure event. Repeated or long-term exposure may contribute to adverse effects that develop gradually and can become harder to trace back to a single job site event, including asthma or other reactive airway conditions, chronic bronchitis and persistent respiratory symptoms, nerve damage and ongoing numbness or tingling,
Liver or kidney injury,
reproductive harm,
certain cancers depending on the chemical and exposure history.
Some chemicals continue to cause harm even after exposure ends, either because they remain in the body or because they damage organs over time. Others can sensitize the immune system, meaning repeated exposure triggers stronger reactions at lower levels. Evaluating risk often involves comparing workplace conditions to established exposure guidelines and reviewing how a chemical behaves in the body over time. Public health agencies also track chemical hazards and long-term outcomes, which can help explain how certain exposures lead to serious disease. If you or a loved one has been diagnosed with an injury that you believe is tied back to workplace chemical exposure, but you are unsure what chemicals you may have been exposed to that caused the injury, you can contact Gianaris Trial Lawyers for a free legal consultation. What symptoms should make me worry about workplace chemical exposure? Symptoms can show up immediately or slowly, depending on the substance and how long you were exposed. Common early warning signs include headaches, dizziness, nausea, coughing, shortness of breath, rashes, chemical burns, and eye irritation. If symptoms persist, worsen, or return every time you're at work, that pattern can be an important clue that chemical exposure played a role. How do I know which chemical caused my health problem? You do not have to identify the exact chemical on your own to take action, but documenting what you can matters. Request the Safety Data Sheets (SDS) for products used in your area, note your job tasks, and write down when symptoms started and what makes them worse. Occupational health professionals and qualified experts can help connect exposure history to medical findings, especially when an employer used multiple hazardous substances over time. What are common health effects of workplace chemical exposure? Workplace chemical exposure can affect multiple body systems depending on the substance, dose, and length of exposure. Some health effects appear quickly after contact, while others develop slowly after repeated exposure over months or years. Respiratory harm is common when chemicals are inhaled, and long-term exposure has been linked to serious diseases, including lung cancer in certain occupational settings. The digestive system can be affected when chemicals are swallowed indirectly through contaminated hands or surfaces. Some substances damage the nervous system, leading to neurological damage that interferes with movement, sensation, or cognitive function. The severity of these outcomes often depends on how long the exposure continued and whether protective measures were in place. Health effects of workplace chemical exposure include
immediate irritation and inflammatory reactions,
burning or watering eyes, blurred vision, nose and throat irritation, persistent coughing, wheezing, chest tightness, shortness of breath, skin irritation, rashes, or chemical burns, acute toxicity symptoms after a high-level exposure, headaches, dizziness, confusion, fainting, nausea, vomiting, abdominal cramping, diarrhea affecting the digestive system, severe fatigue, weakness, tremors, chronic respiratory disease, asthma or reactive airway dysfunction after irritant exposure, chronic bronchitis and long-term cough with phlegm, reduced lung function or scarring from repeated inhalation of dusts or fumes, neurological damage and nervous system effects, numbness, tingling, burning sensations or weakness in the hands and feet, problems with balance, coordination, or fine motor control, memory and concentration problems, mood changes, sleep disruption, liver and kidney injury, abnormal liver enzymes, hepatitis-like inflammation, long-term liver impairment, kidney dysfunction that can show up in lab work before symptoms become obvious, digestive and oral effects, ongoing nausea, appetite changes, reflux or stomach pain after repeated ingestion of residue, mouth and throat irritation from contaminated dust or aerosol settling on food and drink, blood and immune system effects, anemia or abnormal blood counts in certain exposure scenarios, sensitization, where reactions become more severe with smaller exposures over time, reproductive and developmental harm, fertility impacts, miscarriage risk, or pregnancy complications tied to certain chemicals, cancer and pre-cancer outcomes linked to specific long-term exposures, lung cancer in occupational inhalation settings, bladder cancer associated with certain industrial chemical exposures, leukemia and other blood cancers linked to specific solvent or petrochemical exposures, liver cancer risk in exposures that heavily involve liver toxic compounds, mesothelioma and other asbestos-related cancers in legacy industrial and construction environments, skin disease that becomes chronic, persistent dermatitis that cracks, bleeds, or flares with minor contact, skin thickening or scarring after repeated chemical irritation or burns, severe events that require emergency care, chemical pneumonitis after inhaling high concentrations, oxygen displacement or toxic gas exposure leading to collapse or loss of consciousness. What to do if you've been affected by chemical exposure at work. If you believe you've been harmed by chemical exposure at work, the most important steps are to take your health seriously and act promptly. Report the exposure to your employer, seek medical treatment, and make sure the details of what you were exposed to are documented as clearly as possible. Chemical injuries aren't always obvious right away. Symptoms can develop over time, and the connection to workplace exposure isn't always made until much later. That's why documentation matters and why getting guidance early can make a difference. If you have questions about your rights or want to understand your legal options, Gianaris Trial Lawyers represents workers nationwide in serious chemical exposure cases. These matters are complex, and having experienced legal counsel can help ensure your case is evaluated thoroughly and handled with the care it deserves.